Hello, my name is Erin Smith. I have been with the American Lung Association for 3.5 years. I am a health promotion specialist. One of my many roles is managing a tobacco grant that services Douglas County. In today's presentation, we will cover defining all tobacco products, the health effects in both adults and youth who are exposed to secondhand smoke, the different types of exposure, including secondhand smoke, third-hand smoke, and secondhand aerosol. Reasons to consider implementing a tobacco-free, nicotine-free environment, implementing a strong, comprehensive tobacco-free, nicotine-free policy, and resources available to help you quit when you're ready. The map on the right shows all local health departments in the state of Nebraska. However, only Buffalo, Douglas, Hall, Lancaster, Lincoln, Panhandle area, Platte and Colfax, and Sarpy and Cass are the only tobacco prevention coalitions and receive funding from Tobacco Free Nebraska. The Metro Omaha Tobacco Action Coalition, or MOTAC for short, is a dynamic coalition comprised of individuals, organizations, agencies, and businesses. MOTAC formed in 1992 in order to strengthen tobacco prevention and control efforts in Omaha metro area. Since its inception, MOTAC has led Douglas County in addressing tobacco-related issues through public policy, education, and community action. The American Lung Association, Creighton University School of Medicine, Douglas County Health Department, Heartland Family Service, and the University of Nebraska Medical Center's College of Public Health Center for Reducing Health Disparities all have come together. MOTAC serves as a community partner for Tobacco Free Nebraska. Under this grant, MOTAC serves the Douglas County, the largest county in the state of Nebraska. Tobacco-free and nicotine-free childcare facilities is a nationwide and statewide initiative. Tobacco-free childcare facilities is a priority initiative that MOTAC, as well as American Lung Association, leads. Now let's examine the definitions of tobacco products. A tobacco product is defined as any product made from or derived from tobacco or that contains nicotine, that is intended for human consumption or is likely to be consumed, whether smoked, heated, chewed, absorbed, dissolved, inhaled, or ingested, by any other means. This is not limited to any component, part, or accessory. Cigarette, cigar, pipe tobacco, chew, snuff, snus, electronic smoking devices, also known as vapes or e-cigarettes. This definition does not extend to nicotine products approved by the FDA for tobacco cessation. Our definitions are comprehensive, which means that all tobacco products are covered and include all products that have not hit the shelves or market yet. Here are examples of tobacco products. Starting with picture number 1 is combustible cigarettes. Picture number 2 is Swisher Sweets Blunts. Picture number 3 is a newer product called Heat Not Burn, IQOS. Picture number 4 is a hookah device. Picture number 5 is chewing tobacco. Pictures 6 and 7 is snus, loose tobacco that does not require spitting. Picture 8 is flavored cigars. These pictures are dissolvable tobacco products. Dissolvable tobacco products are similar to toothpicks, mints similar to Listerine strips, and orbs similar to Tic Tacs. Dissolvables look similar to everyday candy and mints. So now let's look closer at electronic smoking devices. There are a variety on the market and they contain nicotine, flavorings, and other additives. In addition, these devices mimic the behavior of smoking. All e-cigarettes function by a battery powering the device and a coil heating the solution. They work by heating and vaporizing a solution that contains nicotine. The devices are metal or plastic tubes that contain a cartridge filled with a liquid that is vaporized by a battery-powered heating element. The aerosol is inhaled by the user when they take a draw of the device, just as they would as a regular cigarette. The user exhales the aerosol into the environment. These are types of e-cigarettes. As you can see, they come in a variety of shapes and designs. Here are some pictures of some electronic smoking devices. They use a lithium-ion battery. There are many reports of these batteries exploding while on the charger or in use, resulting in injury, burns, or even death due to an overheating or malfunctioning battery. From 2015 to 2017, there was an estimated 2,035 e-cigarette battery burn injuries presenting in U.S. hospitals, emergency departments. Now, let's look at the health risks. When tobacco is ignited, many chemicals are released. Approximately 7,000 chemicals are released in combustible process. Here is a list of some of those chemicals. Some of the chemicals are common household items. Smoking tobacco has many health effects. They can be divided into short-term and long-term effects. Starting with the short-term effects, which include shortness of breath, dizziness, excess mucus in the throat, increased heart rate, and increased blood pressure. The long-term effects include lung cancer, lung disease, blindness, cancer of the esophagus, and chest pain. Adults who are exposed to secondhand smoke have 25 to 30% higher likelihood of developing heart disease, have 20 to 30% higher likelihood of developing lung cancer, and have a 20 to 30% higher likelihood of having a stroke. Just as with smoking tobacco, there are many health effects of chewing tobacco. The short-term effects of chewing tobacco are increased heart rate, bad breath, stained and discolored teeth, cavities, and decaying teeth, and increased blood pressure. The long-term effects include tooth loss, gum disease, pancreatic cancer, cancer of the esophagus, mouth, tongue, cheek, gum, stomach, and throat cancer, and increased risk of heart attack. The aerosol from e-cigarettes is harmful to the user. We are particularly concerned about the impact of these harmful chemicals on the lungs and the brain. E-cigarettes are a relatively newer product on the market. They emerged on the U.S. market in 2007. You'll often hear from the e-cigarette industry that the two main ingredients in e-cigarettes, propylene glycol and vegetable glycerin, are on the FDA's generally recognized as safe list, but that is only for ingestion, not inhalation. A recent study from the University of North Carolina found that even in small doses, inhaling propylene glycol and vegetable glycerin is likely to expose users to a high level of toxins, and that the more ingredients a user is inhaling, the greater the toxicity. Defective e-cigarette batteries have caused fires and explosions, which have resulted in serious injuries. Acute nicotine exposure can be toxic. Children and adults can be poisoned by swallowing and breathing or absorbing e-cigarette liquid. Nicotine is not safe. The U.S. Surgeon General has found exposure to nicotine during pregnancy harms the developing fetus and causes lasting consequences for the developing brain and lung function in newborns. Nicotine exposure also affects maternal and fetal health during pregnancy and can result in low birth weights, preterm delivery, and stillbirth. Nicotine also has negative impact on adolescent brain development. Nicotine use during adolescence and young adulthood has been associated with lasting cognitive and behavioral impairments, including effects on working memory and attention. Flavors in e-cigarettes are also a cause for concern. Not only are flavors used to target kids, but they may be harmful on their own. E-cigarette and flavor manufacturers or marketers may suggest that the flavor ingredients used in e-cigarettes are safe because they have been approved for use in food, but such statements are false and misleading since they have not been tested for safety when inhaled. Now that we've discussed the effects of tobacco use on health, now let's go over the types of exposure. Secondhand smoke is a smoke produced from burning tobacco products such as cigarettes, cigars, hookah, and pipe tobacco. It is also the smoke that is exhaled or breathed out by the person using tobacco product. Mainstream smoke is directly inhaled and exhaled by smokers from tobacco products. Side stream smoke is smoke that goes into the air from burning a combustible tobacco product. Secondhand smoke contains over 7,000 chemicals. Several of them are toxic to our bodies, including 70 chemicals that are known to cause cancer. Non-smokers and youth are exposed to secondhand smoke, breathe in the same dangerous chemicals that the person using the product inhales. Infants and young children are especially vulnerable to secondhand smoke because their bodies are still developing. Children exposed to secondhand smoke have more ear infections and may develop more fluid in their ears that require tubes to help with drainage, have higher likelihood of having asthma, and those who have asthma will have more severe asthma attacks. Experience more respiratory symptoms including coughing, sneezing, shortness of breath, wheezing, and congestion, to name a few. Have a higher likelihood of having respiratory infections including bronchitis and pneumonia. Have small lungs that are still developing, which contribute to getting ill more often. Mothers who have exposed to secondhand smoke while pregnant often have lower weight babies. And infants who have exposed to secondhand smoke before and after birth have a higher likelihood of sudden infant death syndrome. Third-hand smoke is a residue and chemical left on indoor surfaces even after smoking has stopped. The nearly 250 chemicals found in third-hand smoke cling to clothes, furniture, curtains, walls, bedding, carpets, vehicles, dust, and other surfaces long after a person has stopped smoking. Exposure occurs when you touch a contaminated surface or when you breathe in the gases produced from the surface. Infants, young children, and pets are at an increased risk of exposure to third-hand smoke because they are likely to touch a contaminated surface and put that contaminated surface in their mouth and spend more time on the floor pulling up on furniture. So far in this presentation, we've defined tobacco products, discussed the effects of tobacco use on health, and the types of exposure. The remainder of the presentation will focus on tobacco-free and nicotine-free environments and how to either implement a policy or enhance a policy for your daycare center or your home. The American Lung Association has a model policy that we are more than happy to share with you that you can implement or enhance. We also provide free technical assistance that include assisting you in writing a policy that works best for your daycare center. It is important for a policy to be effective 24 hours, 7 days a week. because it protects children from secondhand and third-hand smoke, and it motivates tobacco users to quit. Why not just have a smoke-free policy? A tobacco-free and nicotine-free policy protects children from secondhand smoke and secondhand aerosol from electronic smoking devices, reduces the chances of nicotine poisoning, and it provides a good example. The policy I am talking about today is stronger than the one that is described by the Nebraska Clean Indoor Air Act specific to child care facilities, child care homes. I'm happy to share this information with you. The Nebraska Clean Indoor Air Act of 2008 required that all indoor workplaces be smoke-free as of June 1, 2009. The law was expanded to include electronic smoking devices, which went into effect November 14th of 2020. This table contains some pertinent information about the Clean Indoor Air Act, specifically for child care facilities and child care run-in residences. For child care facilities, the prohibition applies to, at all times, 24 hours per day, 7 days per week. Applies to employees, parents, guests, contractors, indoor areas, whether children are present or not. For child care homes, the prohibition applies in all areas of the home during the hours when the residence is being used as a child care program. The child care provider must inform parents, guardians, if any household member, including child care provider, smokes in the home. This information must be provided before accepting a child into care. The three main reasons to consider to implementing a strong, comprehensive tobacco-free or nicotine-free policy for a daycare center include: update existing smoke-free policies, improve the health of kids, employees, parents, and visitors, and reduce employer costs. I will go over these reasons more in depth in the next few slides. Update existing smoke-free policies. Tobacco-free, nicotine-free policies are a priority because employees that smoke may replace their cigarettes with smokeless tobacco or non-FDA approved nicotine products during times when smoking is prohibited. We have been referring to tobacco-free, nicotine-free policy to be comprehensive to ensure that it includes the latest trend of electronic smoking devices. Tobacco-free, nicotine-free policies protect children from secondhand and third-hand smoke, prevent nicotine poisoning, and exposure to tobacco products. The second case is to improve the health of employees and visitors. These are the current tobacco use rates for adults. These are the current tobacco use rates for youth. These stats are nationwide, but they also portray the picture in Nebraska as well. Smoking is the leading cause of preventable death and disease in Nebraska, the U.S., and worldwide. Nearly 1 out of 5 deaths every year in the U.S. is tobacco-related. Lung cancer is the leading cancer killer in both men and women. Every year, 480,000 Americans die from cigarette smoking, and approximately 2,500 Nebraskans die from an early death from cigarettes. Secondhand smoke kills more than 41,000 people every year. We know that tobacco-free, nicotine-free policies benefits everyone. They create a safe and healthy work environment, demonstrate your child care cares about the safety, health, and well-being. Children, visitors, and employees are protected from secondhand smoke and third-hand smoke. Policy motivates tobacco users to quit, and enhances the overall health and wellness of children, visitors, and employees. The last reason to consider a comprehensive tobacco-free, nicotine-free policy is to reduce employer costs. Approximately $795 million per year is spent on healthcare costs as a direct result of smoking in Nebraska. About $605 million is lost in productivity. Tobacco users cost employers in terms of increased absenteeism, reduced productivity as a result of nicotine, addiction, missed work time due to smoke breaks, and increased healthcare expenses. Approximately smokers miss 2.6 more days of work than their non-smoking peers every year. A smoker can start to feel withdrawal symptoms within about 30 minutes of their last cigarette or tobacco use. It is these withdrawal symptoms that can interfere with the employee's ability to effectively perform their job. It is estimated that a smoker is 1% less productive than non-smokers. It is important to note that while every person is different, a study estimated that the average smoker takes 2 15-minute smoke breaks per day in excess of regularly scheduled and allowed breaks. A study estimated that healthcare expenses of a smoker is approximately 8% higher than the expenses for that of a non-smoker. Smokers are likely to have more insurance claims and could require employers to pay higher premiums. A recent study found that for every smoker that quits, an employer can save between $2,885 and $10,125 annually. For each employee that quits using tobacco, there's an average cost savings of $5,800 annually. The range is approximately between $3,000 and $10,000 annually during the time of employment. These changes can be seen in the following ways: increased productivity, decreased sick days, decreased healthcare costs, and pension benefits. There are many reasons to implement a tobacco-free, nicotine-free policy. Here's a list of benefits that are specific to the employer. I have gone over a few reasons to consider making your worksite tobacco-free and nicotine-free. Upgrade any smoke-free policy, improve the health of your employees, and save you money. If a tobacco-free worksite policy is right for your business and your employees, it is time to begin the implementation policy process. We now know how a tobacco-free, nicotine-free policy will benefit. However, the big question is how to go about actually implementing a policy change. That is where the Lung Association comes in. One of the biggest questions is, when should this policy change take place and how? It really comes down to a few steps and a detailed timeline in our worksite booklet, which you will have access. The booklet has a 6-month and a 12-month timeline. We can work with each individual daycare center to create a specific timeline for your needs. Each daycare center is different and has different needs. We'll work with each of you to decide what works best for you. The first step is to determine the messaging that you'll be utilizing and the implementation date. A significant piece of the implementation process is to provide employee education on what the policy entails and when it will take effect. We cannot stress enough how important it is to educate your employees, customers, and visitors. This can be accomplished via mailings such as a postcard, flyer, letter. This should go out to everyone who you interact with. It can be done through your website, through your mailings, all your new hires, etc. And we are happy to partner with you on how to go about doing that. Community information is equally important. Letting the community know about this change is vital. An example is posting an article in the local newspaper. The next step is to remove smoking huts, ashtray receptacles, and hang signage. If you're an in-home daycare provider and this policy does not fit your business, please contact us directly. We'd be happy to assist in writing a policy that maintains its integrity, but also fits your business. To qualify for metal signage and window clings, the policy must extend to the entire property and the vehicle for the home. Again, we serve businesses in Douglas County. If your business falls outside of Douglas County, I will connect you with the appropriate community partner to assist you in your county. What our grant can provide you is a booklet, policies, quit resources, and free signage. Some other free resources that we can provide you with include free technical assistance with policy change, eligibility to receive a marketing piece highlighting the policy change, notification letters to employees and parents, tobacco cessation handouts. Now I'm going to go over the resources available to support quit attempts in the next few slides. The Centers for Disease Control and Prevention, or the CDC for short, has found that 68.8% of adult smokers are interested in quitting. Tobacco cessation programs offered at work sites as part of a comprehensive tobacco-free, nicotine-free policy can help tobacco users achieve this goal. It is important to remember that tobacco users are addicted to nicotine, and this addiction is very difficult to overcome. Sensitivity to the needs of tobacco users is important as you provide resources to help them quit. Here are the cessation options available here in Nebraska. Freedom from Smoking is American Lung Association's gold standard smoking cessation program. For those want an online format, Freedom from Smoking Plus is an innovative behavior change program that's perfect for today's mobile lifestyle. Some features of the program include 9 highly active interactive sessions split into 3 phases: getting ready to quit, quit date, and staying smoke-free. It's available on a desktop, tablet, or smartphone, anytime, anywhere. Fully updated with engaging activities, content, and tools, includes fully integrated telephone and online chat support from the American Lung Association's expert tobacco cessation counselors at the Lung Helpline. The Lung Helpline and Tobacco Quit Line is staffed by registered nurses, respiratory therapists, pharmacists, and certified tobacco treatment specialists. It's available to anyone looking to start a quit smoking attempt or wanting telephone counseling from an expert over the course of his or her journey to quit smoking. The American Lung Association sponsors the Quit Now Freedom from Smoking online social support community on the Inspire platform. In this community, quitters share their struggles, successes, and quit journey with others. Empathy connects, encourages sharing, and supports members throughout their journey. Loneliness is often part of living with chronic conditions, including an addiction to tobacco. Through their online community, members have a social outlet and provide warm welcomes and emotional support, making the experience positive and friendly. By sharing stories, patients and caregivers in community educate, inspire, and empower each other. The Nebraska Tobacco Quit Line is an online service available free to residents. When you become a member, a support coach will provide research-based information for those who are trying to quit using tobacco. Coaches are available to discuss overcoming common barriers such as dealing with stress, fighting cravings, coping with irritability, and controlling weight gain. The Quit Line provides 3 different quit programs designed to meet your style of communication. All quit programs will provide dealing with emotional, behavioral, and physical aspects of quitting. It is available 24 hours, 7 days a week. So overall, a tobacco-free, nicotine-free policy protects non-smokers from secondhand and third-hand smoke, encourages tobacco users to quit, and creates a positive company image. When implementing a policy, it is important to establish a comprehensive policy, educate employees and visitors, and post signage. If you're interested in moving forward with a policy change, the next step would be to contact us. We would love to meet with you individually and create an action plan that fits your worksite's needs. We are here to help with every step of the way and make it as easy as possible for you. Thank you for joining the webcast today. Please reach out to the American Lung Association for any questions, and we're happy to connect you with a community partnership in your area if you're outside of Douglas County. We can be reached by phone at 402-502-4950 or by email at nebraska@lung.org. Thank you.